4:59 p.m. Welcome, everyone. Good to see everyone today. Hope everyone's enjoying their week and have had a productive week thus far. We'll get right into our meeting. And if you all have had an opportunity to review the agenda that was sent out earlier this month, I will entertain a motion to accept that agenda. If there are any corrections or additions, I'll entertain a motion to add those additions or corrections.
Motion to accept the agenda.
Second.
All right, it's been moved and properly seconded to accept the agenda as printed. Do we have any debate? Hearing and seeing none. Ms. Murphy, we are ready for the vote.
Hi, can you all hear me?
Yes,
Yes.
ma'am.
Okay, great. Chair Roger McDougall,
Yes.
Vice Chair Dr. Ray,
Yes.
Dr. Rosemary Jackson, Dr. Jim Miller,
Yes.
Commissioner Alam, Dr. Glover, Dr. Orto,
Yes.
Mr. Gregorio,
Yes.
Mr. Brown, Dr. Jackson, LaRon Jackson.
Yes.
Thank you.
All right, thank you. So hopefully everyone has had an opportunity as well to review the minutes from our May meeting. Provided that you have done that, I will entertain a motion to accept the agenda. The minutes that were published.
Motion to accept. Second.
All right, it's been moved and properly seconded. If there's no unreadiness, we are ready for the vote.
Okay, Chair McDougall,
Yes.
Vice Chair Dr. Ray,
Yes.
Dr. Rosemary Jackson, Dr. Miller,
Yes.
Commissioner Alam, Dr. Glover, Dr. Orto,
Yes.
Mr. Gregorio,
Yes.
Mr. Brown, Dr. LaRon Jackson.
Yes.
Thank you.
Thank you. All right. Ms. Murphy, have you received any notification of any public comments for this meeting?
No, I have not.
Very good. So at this time, we'll move on and give the floor to our director for any staff or program recognitions.
Thank you, Mr. Chair. Just want to make sure you can hear me.
Yep.
Right. Good evening to this great board. Just two staff recognition, program recognitions for your consideration. On Saturday, May 18th, the Men's Health Council of Durham Public Health was honored by the greatest fraternity in the world, Phi Beta Sigma Fraternity, Durham Alumni Chapter. I was pleasantly surprised by this award, but at the same time, I was delighted to be in attendance to accept the award with members of the council, to include the leader, Mr. Elbert Dorsey, Vice Chair of the council, Mr. Bradley Long, and also the great Ms. Joyce Page, who's the coordinator, and many other members. We were really entertained, and we certainly were treated to a beautiful affair with a nice dinner and everything. But this also received a lot of media attention. So I definitely want to shout out Joyce Page and the hard work that she does. Not only has she been honored individually for her work with the Men's Council, but she also has been honored collectively. So just wanted to bring this to the board's attention. And then, of course, the board did hear last Friday that we recognized our women's health team on receiving the National Association of Counties Achievement Award. And that's for their work with the Women's Health Nurse Navigator setup that we have. This is a huge honor, not to be taken lightly. National Association of Counties That's where all our county commissioners and all of our county work is being recognized. So we're grateful for the work of Tanya Luna and Tressa and our awesome nurse navigator, Ebony Quick, all under the leadership of our director of nursing, Kiki Rayner. I just wanted to really give them their flowers and their kudos, but that's all I have, Mr. Chair. Still on mute, Mr. Chair.
It's been a long day. Thank you, Director Jenkins. I just wanted to say that I will rubber stamp that kudos that you gave out to all those staff members for their excellent work and continued service to the Durham community. We will move on with our administrative reports and presentations. First on the list, we have an opioid settlement presentation by Kristen Patterson.
Good evening, board. How are you all doing?
Doing well, thank you. Hope you are.
Yes.
Awesome.
Can you all see my screen?
Yes.
So, thank you all for allowing me to present the Durham County opioid settlement. This is an honor. And also with this opioid settlement, a lot of hard work has gone into this program. And so I just want to say thank you and also let you all know that not only have I worked on this this effort, but also some of our Durham County employees have worked on it, such as Lindsay Bickersbach, Dennis Hamlet, and none other than Ms. Micah Gwendon. So I just want to give them their props because it's not just Dwayne, Assistant County Manager Dwayne and I, but it was a collective team, and Ms. Helen Tripp, who's with our community paramedics. So whenever we're talking about our North Carolina opioid settlement, we have selected, so there's two different lists. So we've selected off of the shortest list, strategies that are evidence-based and high impact approaches to address our epidemic on opioids and how we're gonna actually attack this epidemic is using the settlement funds. And also from having a collaborative strategic planning session, we noticed that off of the longer list, we need to adopt some of those strategies as well if we're going to be impactful. So there is a process, and it's a very long strategic process in actually getting these funds approved. So first we had to have you all, we had to have the commissioners to approve a resolution for our MOA. Then a special revenue fund had to be created because all of the opioid funds have to live in one centralized location within our finances. And then we noticed that in public health, we had some existing efforts and we do not want to duplicate efforts. So we had to take an approach to see what was going on. What do we have already in play that was dealing with opioids? How can we expand on these services? So we had to take a deeper dive into our existing efforts. Then we invited the community for input session. And through that session, we had a dedicated website, and also we have an online survey, and not to mention the community input session. Then there was the resolution was signed to wave 2, and we established an internal work group in January of 2024. And from the survey, we received from the survey. The survey was actually launched on the survey was actually launched on December the 7th, 2022 until January 31st, 2023. And there was actually 554 responses from that survey, which that was outstanding. And from the survey, we noticed that our higher priority areas were evidence-based addiction treatment, early intervention, strategic planning, recovery for housing, and recovery support services. This is what we received from those surveys. So back in March of 2023, we hosted some community input sessions. There were 68 attendees from diverse stakeholder groups. And the results from that input session were similar to the ones from our online survey. Our citizens, they wanted to see more evidence-based addiction treatment centers or evidence-based addiction treatment services, and also evidence-based recovery support services and recovery support housing. As you all know, in most every community, housing is a big issue, and affordable houses is a big issue. And I'm not going to read through all of this because it is a very busy slide. However, I wanted to highlight that we listened to our community, and our priorities were addiction treatment centers. We're going to address that through providing funding for evidence-based treatment, such as our MAT program that will be housed within the jail. And also with the recovery support services, the community linkage to care. And I think I forgot to mention Ms. Lacey Schofield. She does an outstanding job with our community linkage to care. And with this opioid funding, it's allowing us to be able to expand on those services. And so we've also, we're pledging to attack the recovery support for housing. And with this funding, we'll be able to provide support for people in treatment or recovery housing. And we'll also be able to provide assistance for move-in deposits or funding for recovery housing. So if someone wants to go to treatment, they can't afford it, we have funding to pay for this treatment. So our opioid settlement fund for Durham County is set to receive nearly $21 million over the next 18 years for opioid settlement funding. And this is how the state has broken it down, you know, how we're supposed to receive this funding. And these three activities have already, or strategies have already been approved by our Board of County Commissioners. One is the harm reduction, public health harm reduction, also our community linkage to care, and our opioid settlement manager position. And I'll go into detail of these three initiatives later on in the PowerPoint. And so we do have a draft 24-25 budget. And as you can see, these are the amounts that we have budgeted for our public health harm reduction, the community linkage to care, the opioid settlement program manager, that's with salary and fringe, it's $145,119. The sheriff office has asked for a medical director and 2 community paramedics. And I know we have here the Harm Reduction Coalition drug tracking or drug checking program. That program is currently, basically what we did, we received information on this drug tracking program. So I'm not sure if it's going to be funded because it's now sitting with legal, because there is some legal ramifications behind this intervention, but we want to at least put it on the budget because it was asked for by one of our county commissioners. And so although we're projected to spend, the planning spending for fiscal year 24-25 is a little over $1,678,000. But what we as a team have decided to do, we know that our first year, because this is our implementation year, it will be slightly higher than what we want to see for the next 17 years of this spending, because what we as a group decided to do was have stabilized spending of 1.3 million annually. That way, if we fall short in one year, we will have other funding from the previous year to be able to make up that cost. And with doing that, we decided not to recommend our youth home diversion coordinator because the youth home already have one. So it's not like we're saying no, but they have a coordinator that's already working for the youth home. And our community paramedics case manager, we decided not to fund that position because all of our community paramedics are trained to perform that task with case management. And we're trying to really be mindful of how we spend these dollars. And so there is a approval process. And as I stated before, this approval process is very tedious because not only do our Board of Health, if there's any initiatives within the budget for public health, we have to not only have our county commissioners to approve our spending authorization, but it first has to come to you. Or if it's the sheriff department, if they have a board or any other area or department within public health or within Durham County, if they're going to spend funding, their board has to approve for them to spend the funding. Then we have to take those forms and have our county commissioners approve the spending forms. And after that, our assistant county manager, Dwayne Brinson, he then have to upload these forms for Core NC to approve. And Core NC is a collaboration of the North Carolina DOJ, Department of Health and Human Services, the North Carolina Association of County Commissioners, and UNC Injury Prevention Research Center. So before we could spend any money, Core NC has to give the final approval. That's just how strenuous it is. And they also let us know as a county, if any funds are spent before they approve our plan, then the county will be held liable. We could not go back and pay for those activities, before these plans are approved. So we are really holding tight. We are really making sure that we dot all of our I's and cross all of our T's because we don't want our county to have to pay for, to pay unexpected expenses. So that's why we're kind of going a little slower, making sure that we have all of our guidelines. We know the guidelines before we embark on any spending. So as I mentioned before, public health, we have 3 different areas in which we are using the opioid funds. And our harm reduction specialist, this position will lie within our health education. So Dennis Hamlet is actually the supervisor of this individual, and he's in the process of hiring. I think his packet has gone up already, so he has the ball rolling. And so we will also, within our harm reduction allotment of funds, we will provide Narcan to our pharmacy and also stock our 2 of our vending machines. And I think the health education department, they are in the process of purchasing another vending machine. And so those vending machines will be stocked with naloxone. And also our pharmacy will receive monies or health education will receive the money, but buy supplies for our needle exchange program, safer syringe program within our pharmacy. And also we're considering hiring outreach workers who have lived experience, because they're able to go out and actually share their story with someone else to make it so that they'll know that we do care and we are trying to actually support their them getting into treatment, and not just leaving them there, but also having someone just work with them along the way. And so we're hoping that by having people with lived experience, it will make a positive impact within our community. Next, we have our community linkage to care, and our community linkage to care is just that. Their support, peer support program, who are helping to connect individuals who are struggling with substance use disorders with a comprehensive evidence-based care. And also they acknowledge the social determinants of health in response to even our current housing challenges. So the housing piece and our links to care, they really go hand in hand. And it was so important for us to really enhance this program, because we see that the great outcomes from this program. And Lacey and her team, they're doing an awesome job. So that's why we thought this was one of our programs that we need to enhance, because it's already they're already doing the work. So why not fund this program? And next, we have a program manager. So we've talked about so many different programs with this opioid, with the opioid settlement funding. We needed someone here who could keep track of everything that's going on, because this is such a high profile opportunity within our county. And we want to make sure that the funds are going where they need to go. And we want to make sure that we are good stewards over this funding. So this individual will really keep track of the day-to-day operations, and also grant writing, also because we know that this is an 18-year fund is funded for 18 years, but there's also going to be some gaps in where we may need extra funding to facilitate different programs. So we're in the process of setting up interviews for our opioid manager, and the opioid manager will actually be supervised by myself, but will also work in conjunction with our harm reduction specialists, as well as our community partners as well. And the community paramedics, so this is Helen Tripp. She is actually the supervisor over these community paramedics. Community paramedics, there are actually 2 full-time community paramedics and 1 program manager. And so we're going to increase their capabilities by adding 2 more community paramedics, because she let us know that 61% of the calls from Durham County are opioid related. So they need extra people to help them. So there is a problem here. And these are specialized paramedics who only work for opioids. They do not do anything, they're non-emergency. So they're only working for the opioids and helping individuals to reverse their opioid overdoses. So they will receive 2 more paramedics for their wraparound services. And as I said before, there will be a medical director for the sheriff's office to work and manage all of his opioid-related programs and the medication assistant treatment programs, the MAT programs. And this drug check-in program, this is on hold because our county attorney is currently reviewing this initiative for liability purposes. So I don't know if we're going to actually have this spectrometer. I don't know, because we know that UNC has a drug checking program, so we may just contract or collaborate with UNC to come into Durham, so that it's not a liability on Durham County. And so the path moving forward, what we're hoping to have in the next month or so is an opioid manager to be able to help assist with the development of an advisory board and also a scorecard. We want to make sure that we are doing what we're supposed to do by providing our community and our different boards information about how we're doing now and how we're doing in the future with our stats, because we know that numbers drive everything. Then we want to be able to provide a scorecard for our stakeholders. And these are additional resources. If you would like to see information about Durham County, what we're doing with opioids, you can always visit our manager's office departmental page, because we have our surveys and just a plethora of information about what Durham County is doing with opioids. And also, we ask you all to visit our North Carolina ACC opioid settlement team webpage. They have so much valuable information. Dwayne and I, we use this website on a daily basis because we have to make sure that we're in compliance. And so they have all of the rules, the regulations on these websites. And we actually, like I said, we go on these websites daily. So this concludes my presentation. This is the same presentation that we submitted to our Board of County Commissioners. And we just wanted to let you all know what we were doing in the community. And I thought it was valuable if you knew high level what was going on in the county, not just public health, but this affects the whole county. So if there's any questions, thank you so much for your attention. Yes, sir. Mr. Anthony.
Yes, thank you, Ms. Patterson. That was a wonderful presentation. Thank you for sharing the education. Just two questions. Could you remind me what Wave 2 is again? I saw that it was in the Durham County process slide.
So Wave 1 was certain counties were able to sign on to Wave 1, but Wave 2, that's where Durham County lied in that wave. So we weren't in the Wave 1, and it's only whenever you sign on. So we were able to sign on to Wave 2. That's when we finished with our, I think with the lawsuit, the way the lawsuit was working.
I see. Gotcha. Thank you. And do you have any comments on where the vending machines might be placed at?
So there's one vending machine here in public health. There's another one in the jail. And the third one, we're not really sure. I think they were talking about maybe one of the libraries, because we have noticed that with risk management, they've noticed that there was an uptick of individuals coming into the library who actually were either overdosing or the library staff, they noticed people were coming in using drugs. So not only are we trying to place a vending machine there, but in all of our I think it's called AEDs, there is naloxone in those as well.
Gotcha. I was actually thinking as well the like the bus terminal. I feel like that might be a high traffic area.
Yeah, so. Okay. I'm gonna write it down.
Yeah, more the merrier, right?
Yes.
Thank you.
Thank you.
Ms. Patterson, I had a question, and I'll begin again by saying thank you for the wonderful presentation. With the settlement, you had a slide earlier that listed out, I think, 3 things that were already approved for funding: the opioid settlement manager position, community linkage to care program, and then there was one other thing. I think it might be the reduction of harm. But I was wondering if we have an idea when the medical director at the sheriff's department would be funded or approved, for that funding would be approved, or has it already been approved?
So that was in, if I'm not mistaken, I think that was in the budget for the county. And that budget was approved, I think, last week, like Monday, right?
Okay, so that
Monday,
won't
so
be a
it
part
was
of
already
this.
approved.
Gotcha. So it's outside of this. Gotcha. Thank you. Appreciate that.
Yes, ma'am, Dr. Jackson.
Thank you. I also have an additional question regarding any plans for the development of recovery housing and kind of looking at that being a need expressed by many stakeholders and folks that have come to the input sessions.
Yeah, so actually that would be a capital project. And that is actually one of the long-term projects. And from my understanding, I think they're trying to revamp some apartments for housing, for recovery housing.
And the funding for that will come from which?
From opioids.
Okay. And how much has been earmarked for that? Are we aware? Do we know?
I'm not sure, but I can find out for you.
Okay. And one more follow-up question to that. Would the recovery housing be based upon any particular models that have maybe been successful elsewhere in other communities that are similar in size and character to Durham?
I think they're still researching that piece because that would be a capital project and that would live in our judicial piece.
Thank
So,
you.
but I can also get that information from ACM Dwayne Brinson because I think he's over that piece. And so he should be able to answer some questions or even give us some thought of how the process will work.
Thank you.
You're welcome.
Do we have any other questions for Ms. Patterson? All right, so once again, thank you, Ms. Patterson, for a fantastic presentation. We certainly appreciate all of the knowledge that you shared with us. We'll move on to the next presentation, which is our telehealth presentation, and we'll give the floor to Dr. Jenks and Ms. Richardson for that.
Good evening, everyone. Thank you, Chair McDougall. Can everyone hear me?
Yes, sir.
Okay, yeah, so Marcia and I are gonna tag team this, and I'm gonna let her talk a little bit about kind of the current telehealth technology that we use at the health department. Marcia, you may be muted.
Yes, I was just talking away. Good evening to the board. So a little bit about the technology here within our department. We currently use our UNC Epic instance. And so tied into Epic, we have a solution called Amwell. And so that is for our video visits. We're happy to say that beginning July 16th, we will be able to have the functionality of video visits in Spanish. So we're looking forward to that. Also in our clinics, we also use our FaceTime for patients, and we use that for our direct observation therapy, which you'll hear a little bit more about that with Dr. Jenks.
Yes, I want to just give a brief history of telehealth here, and then I'll talk a little bit more about what clinical areas it's currently being used. So telehealth really started here, like it did in a lot of places across the country, in the early days of the COVID-19 pandemic, when really out of necessity, telehealth services needed to be offered. And so this predated me, but where I came from at the University of California, San Diego, we started doing the same thing, offering telehealth services, across all the departments. And the same thing happened here. So telehealth was commonly used in a number of the clinical settings in our sexual health clinic, family planning clinic, tuberculosis clinic. And then, as COVID-19 vaccines became more available, telehealth really, the services being offered or the number of people who were partaking in telehealth visits really dropped because people started coming back into clinic. And it's really, for most of the services we offer here at the health department, it's much easier and more efficient to, see people in person. If they come in an immunization clinic, they need to get immunizations, or our sexual health clinic, pretty much every single person needs to get labs drawn. Family planning clinic, folks are getting birth control prescribed or getting pap smears or IUDs placed. So for really most of the clinics, it's really better to have clients come in and be seen in person. I think, one exception is the tuberculosis clinic. I'll talk about that in a minute. Marcia, you can advance. Yeah, and so, we started thinking about this, again, over the past few months, just really kind of updating our telehealth policy, which we've done. And then currently, we looked into, after this question came up last board meeting, how often are telehealth services being used here? Really not very much at all, with the exception of nutrition clinic and then tuberculosis clinic. We really rely on video visits for directly observed therapy. It's just much more convenient for patients and for staff to be doing these DOT visits over FaceTime, for instance, rather than the patient having to come into the health department every day, or the TB nurse go to their home every day. So, the law here in North Carolina is, directly observed therapy needs to be done. And for a week of TB treatment to count, for instance, there needs to be 5 documented DOT visits that week. And so we typically will do DOT Monday through Friday. And so really doing it over video is just much more efficient and practical. I mean, patients may be, sometimes hard to track down, or they're working during the day, so they really can't come in here. So just a 5 or 10 minute phone call really makes a world of difference. And these are just our eligibility criteria for telehealth services. So, obviously we don't want someone in the midst of a medical emergency trying to schedule a telehealth visit. They need to be kind of registered here or seen here at the health department previously. And that's really just to verify, they are who they say they are. So we want at least, them to have registered in the front of the building, at least, to be seen. And then obviously give us, verbal consent to do a telehealth visit. It does get more challenging. So for our clients for whom English is not their first language, we can do telehealth visits. It usually will involve phone calls. Now, as Marcia mentioned, it will be easier to do video visits through Epic in the next week or so once that's rolled out. So that may change a little bit, but we typically will use the language line phone services for telehealth visits, for instance, like with DOT. This is very small. I didn't put this on here for you to try to read, but this just shows, like, we really, especially with our new policy, we really did think this through, kind of the flow and how these telehealth visits would be offered and applied. So these flowcharts are available in our policy. I know that was brief, but that's kind of the state of telehealth here at the health department. I'm happy to answer any questions that y'all may have. Dr. Jackson.
Yes, thank you so much for that presentation. And it's good to see kind of the progression of how things have been affected by the ebbs and flows of the pandemic. The question that I have kind of moving forward is, as we are out of the peak of the pandemic right now, what are some alternative ways that we can think about using telehealth? Maybe those who maybe in outlying areas or maybe have other difficulties in accessing health department, in situations where it may be applicable, obviously, if they need an in-person visit.
Yeah, Yeah, that's a great question. And I know, we've thought about this, for the sexual health clinic, for instance, and you could do this in family planning clinic as well, just have like asynchronous visits. So someone maybe could do a telehealth visit and then come to the lab another day when it's more convenient for them, that it all wouldn't have to be that day. So there are ways we could do this. As I alluded to earlier, though, for the most part, most of what we do here, at least in our, outside of nutrition clinic and our other clinical settings, typically a visit will involve getting an immunization or getting labs done or getting, swabs done in the sexual health clinic. So typically that would be necessary. Now, it wouldn't have to happen that day. And so that could be an option for someone that says like, I can't get there this day. I really want this service today, but I can come back to the lab another day. And that's something we can think about, rolling out.
Thank you.
Any other questions? Chair McDougall, did you have your hand up?
I did not have my hand
Okay.
up. I was thinking of a question though. I think I already know the answer, but I'm thinking particularly about the TB clinic. I can see readily why and how telehealth services are very advantageous from a safety standpoint for the staff. If you had a patient who suspected they had TB but didn't have a device at home, obviously that patient's going to have to come in, right? Okay.
Yeah.
So we're not expanding this service to offer devices for those who don't have them, I guess is my real question.
We tried that with limited success. So it just got complicated with getting a phone plan and things like that. We have at times had people that do have transportation but don't have a phone or can't use the video component. Drive up to the curb and they, the TB nurse will just walk out there, watch them take their medication, and they drive away. So we have had someone do that recently who lives really close to the health department. And then we will at times the TB nurse will go to the home. It's just to do that every day. It just really, it's just not super efficient. But yeah, if someone doesn't have a phone with video capability or they can't use the component, yeah, we'll do it the old fashioned way.
Gotcha. Okay. Thank you.
You're welcome.
Do you have any other questions for Dr. Jenks and Ms. Richardson? All right. Well, thank you for that presentation. We really appreciate the sharing of knowledge. All right. Well, we're moving on here. We have our health vacancy report next on the agenda. So I will let our director speak to that. It looks fairly standard, maybe a little uptick in the level of vacancies that we have compared to last month, but not too much.
Yes, sir, Mr. Chair. It's fairly status quo. We got a little bit of a bump, and as you can recall, I think in my own way, I just kind of let the board know that we were anticipating somewhat of a bump, primarily because of a number of things. But I think the main thing is we did have some resignations, but I'm proud to report that we've also had some promotions. And with that, when people get promoted, that position becomes vacant, and we are able to hopefully bring more of our people from the lower levels of leadership on up. So that's what we have experienced as of lately. But we did have a number of individuals for various reasons, be it promoted or transferred from, say, for instance, Dine to become part of Cooperative Extension's food security coordinator position. So again, we continue to do the best that we can, but I think the division that we had the most vacancies under the leadership of Director of Nursing Kiki Rayner, they have done a marvelous job filling those vacancies. So we look forward to really reporting definitively that the school health team is fully staffed. but we continue to do all that we can to fill positions quickly. I also will say to this board that you may have heard the board of the county manager, Dr. Kimberly Sowell, indicate that there will be a hiring freeze. That will go into effect. We have been frenetically trying to fill and post positions as soon as we can in anticipation of that due to some budget woes that the county is facing. But we have received the assurance that since public health does provide essential services, we will have more of a clear path to getting positions unfreezed so that we can fill those positions. So wanted to share that with the board as well.
Okay, thank you. The next item on the agenda is our public health NOV report. I don't remember seeing
Mr. Salter, he's with us.
Is he okay? So if you wanted to make any comments on the NOV report, Mr. Salter, we'll let you do so now.
Yes, sir. Just briefly, looks like last month we were able to bring one NOV into compliance, but we also added a new one. One thing that is of it is noteworthy is we did have an opportunity to meet with attorneys Malott and McKinney, and so we had some good discussion about the NOV report and some other aspects of environmental health, and I'm looking forward to working with them to look at legal remedies, and they did have some ideas of some things that we can try, so maybe we can make some headway in those respects. Also, this is noteworthy. If you look at the report closely, you'll notice that there were quite a few added notes about potential connection to municipal sewer. I believe about 8 out of the current 29 active NOVs either have applied for or have already been approved to connect to municipal sewer. So that's a positive thing. However, again, like I stated last month, it's about a 6 months to a year process, and we have no idea how long it's going to take, so that's it's a good thing, but it's frustrating that it's going to take some time to get them connected.
Okay. Well, I appreciate that. Do we have any questions for Mr. Salter regarding our NOV report? All right, thank you, Mr. Salter. As always, we appreciate your hard work. The next thing on the agenda is our health director's report. So we'll give way to Director Jenkins at this time.
Thank you, Mr. Chair, and to this illustrious board. I'm happy to answer any questions that you may have about the health director's report, but I'd love to bring your attention to a couple of things. Number one being from our population health and epidemiology section. One thing that we have always touted to this board was the county health rankings. And that's something that we look forward to every year. But as you can have read, there have been some changes. They're not doing rankings per se. They're just pretty much indicating those counties that are above average, those counties that are below average. Of course, we're proud to report that Durham is above average with our peer counties, and also we're above average, considered to be above average county in the nation. So that also speaks to the fact that Durham continues to be a healthy county that people want to come to, but more importantly, businesses and industry want to come to, because that factors into their decision as well. The second thing I wanted to bring your attention to was also along the lines of the oral health screens that are being done by our fabulous dental team. Just want to really lift up the fact that they were able to complete about 9,200 plus children's screenings this past year. That is no small feat. That goes with a lot of coordinating of efforts when it comes to working with Durham Public Schools, when it comes to the coordination of the services with the class and the schools, and couldn't be more proud of the team, and of course always challenging them to do a little bit more if they can. But Jim Harris runs a very tight ship. He does a very good job, in addition to running an operatory that also here at the Health and Human Services building We do a lot of outreach. We can also go to a lot of different health fair and health clinics and neighborhood activities. Additionally, the last thing I'll just say is Christian did a fine job. Definitely want to lift her up and thank her for her work with our opioid efforts. That is under her bailiwick. Of course, as health director, I'm completely responsible, but I just said, Christian, I want you to take this and run with it. So she has been working the main point person for the county health department in working with Assistant County Manager Dwayne Brinson. But very proud of the work that we've been doing with the naloxone vending machines. As mentioned, one is at the detention center, one is here at the mothership at the Health and Human Services building. We did have some discussions about the library as placing one of the library, as Christian mentioned. But I also would like to just lift up the fact that since September of 2023, over 600 naloxone kits have been dispensed, either from those vending machines or definitely coming from us being able to provide it in our pharmacy. So we are putting in work. We're doing our best to get those life-saving medications out into the community, and we certainly look forward to these funds that we're about to present to you all for approval, doing a little bit more work in the community. But that's all I had. Just want to really emphasize 3 solid points, and happy to answer any questions you have.
All right. Well, I had a couple of questions or comments maybe. So you spoke about the population health report or portion of the report, and I'm certainly glad to see that at least with the ranking system, if you will, now and that began in 2024, that we are faring better than the average county in North Carolina and better than the average county in the nation. But I know that some of the outcomes were a little concerning in that, we had some residents reporting poor frail health increased since 2023. Diabetes prevalence increasing, drug overdose deaths, so on and so forth. With those things going in the wrong direction, are we seeing that trend? Do you know on the national level and even on the state level? And I know that there was a statement that mentioned that we're going to continue to analyze the data and work to make the health of our citizens better. But I was just wondering where we are falling, since we're not being ranked anymore. How are we falling? How are the other places in the state and in the country doing with those particular metrics? Do we know?
I would say at this moment, Mr. Chair, we don't know because the information is still fresh. And as this board knows, oftentimes when we get our reports from the state Department of Public Health, it is normally 2 years behind. So we are doing our best to really, under the leadership of Marissa Mortarboy and our data scientist, John Paul Zeta, and our epidemiologist, Savannah Carrico, we're doing our best to really sift through this new world that we're in. There used to be a lot of unreadiness about the rankings because they had ever-changing algorithms and methodology of how they ranked them. At one point in time, if you had a number of liquor stores in close proximity, then you got dinged on that. If you didn't do X, Y, and Z, you got dinged on those things. So we truly do have our work cut out for us for doing it, but some of the outcomes didn't come as a surprise when it comes to like diabetes, when it comes to like crime, when it comes to gun violence, because through our community health needs assessment, we know that those are the things that plague our community. But again, when we do look at birth outcomes, and they're saying that kind of holding steady. We know that that's a positive, but at the same time with diabetes and everything, we know that that's a nation problem. So long answer, but the short answer is we still got work to do to investigate.
Thank you. And I had at least one more question. So as always, I'm impressed with the work that's being done in the oral health, the dental clinic. But I did read one of the challenges kind of caught my attention, that there are a number of requests to have these screenings at various middle schools, but due to limitations, select sites or all the sites that make requests aren't able to be serviced. So I think I asked this question before. Has there been any consideration about maybe partnering with UNC or even soliciting private practitioners to volunteer so that some of these other schools that are requesting these screenings and Tooth Fairy clinics to man those clinics so that we can maybe meet more of the demand or the requests that are put out there?
I would say the answer to that is yes, Mr. Chair and members of the board. And I think that the opportune time is going to present itself when that new superintendent is named. I'm going to personally ask for an audience with this individual, just from a good business perspective. But then I'm also going to let them know about some of the issues that we face, be it school health nursing, be it oral care that we're trying to provide to the students, or be it just youth risk behavior surveys. I mean, I want them to understand that this is a community that is all about working together to improve. So if there's some things that we can do, particularly given the things that you just you've said before in the past, and you just said those things that we can do in order to try to get better oral care for our middle school students. So we still have that on our list in terms of trying to get that accomplished.
Thank you. Appreciate it. Any other questions or comments? As always, great work, Director Jenkins, to you and your staff for all the great things that we're doing as a health department. We certainly are appreciative of your work. All right, so we don't have any committee reports or old business. So we're down to item 10 on our agenda, the new business. So I'd like to ask if we have any new agenda items or agenda items that we would like to see on our August agenda.
I will say, Mr. Chair, if I may,
Yes, sir.
we would love to present to this board the results of our CLIA inspection that is set within the next couple of weeks. We'd love to provide you with that. I'm going to already claim victory speech and victory information to this great board. I like to throw positivity up in the atmosphere, but staff has already asked me whether or not we would be, if the board would be amenable to receiving that report.
Absolutely. Thank you. All right. Anybody else with any suggestions of other agenda items for our August meeting? Okay. So we'll move on to our opioid settlement fund funding request or approval.
Forgive the difference in semantics, but this is just a budget amendment for the board's consideration. The board is requested to approve budget ordinance and spending authorization amendment to allocate $923,866 of opioid settlement funds awarded to Durham County. This health department will use the funds to advance 2 strategies that have been identified. Those strategies include collaborative strategic planning and recovery support services programs, as evidenced by Exhibit A of the Memorandum of Agreement between the state of North Carolina and local governments on proceeds relating to the settlement of opioid litigation. How the funds will be broken down, members of the board, $145,111 will be allocated to create the new county opioid program manager position that Christian eloquently talked about earlier. $436,719 will be used to continue our great work in our community linkages to care peer support program under Lacey Schofield, who does a really good job. And then $342,028 will be allocated to support Durham's harm reduction initiative. Included in these funds is also the salary and fringes for a public health education specialist with a singular focus on harm reduction, as well as some contract staffing as well to for individuals to do outreach, and these individuals are going to be required to have some lived experience with substance abuse. That is it, and we ask the pleasure of the board.
All right. If we don't have any questions about that budget amendment, I will entertain a motion to accept the amendment.
I'll make a motion to accept the amendment.
Second.
It's been moved and properly seconded. If there's no unreadiness, we are ready for the vote, Ms. Murphy.
Okay, Chair McDougall.
Yes, ma'am. Yes, I vote yes.
Thank you. Vice Chair, Dr. Ray,
Yes.
Dr. Rosemary Jackson, Dr. Jim Miller,
Yes.
Commissioner Alam, Dr. Glover, Dr. Orto,
Yes.
Mr. Gregorio,
Yes.
Mr. Brown, Dr. LaRon Jackson.
Yes.
Thank you.
Thank you. All right. So we are at the point of our agenda where we have informal discussion or time allotted for informal discussion. I wanted to give our director a few moments to just share an idea with the board about maybe modifying our meeting schedule. He and I had a discussion a few weeks ago about that. So we'll let him share a little information with you and we can mull over that and maybe discuss it and vote on it at the next meeting. So Director Jenkins.
Thank you, Mr. Chair. And to the members of the board, thank you all for hanging in there. I promise to be real brief in keeping with our brevity of our meetings. We are truly respectful of your time and your energy. We know how busy you all are and the supreme sacrifice that goes with being a public servant and serving on boards. When I reflect back to how benevolent this board was with us during times of COVID, when we were working long hours and didn't necessarily have the time or the energy to put together board packets and to do things the right way. I remember that this board thought it not robbery to meet every other month. We also thought about possibly looking at like-sized counties and looking at other counties in our Dowling County jurisdiction and see who meets quarterly. Like-sized health departments, similar to Durham, they don't necessarily meet quarterly. It's really the smaller ones. However, the Forsyth County, the Randolph counties, and others, they meet every other month. What this does is it does afford the board members a little bit more flexibility. So there's a lot of pros to it. The only con is, of course, when we do meet, the meetings may be a little bit more lengthier, but I think it's safe to say that Durham Public Health, we have kind of mastered the ways of being brief and just being straight to the point and making sure that we get the best out of your time and your attention. So we would just like for the board to consider, if at all possible, maybe moving to meeting every other month. We will still be fulfilling our statutory obligations. I'll make sure I check with Attorney Malott just to make sure. But at the same time, it will definitely give us an opportunity to take care of business, but in a shorter period of time. But please, we just ask the board for your consideration.
So we will allow you to think about this for the next, over the summer, and when we come back together in August. If our hearts and minds are, we'll find out if our hearts and minds are in the same place, and we'll entertain a motion to make that change. And if it fails, it fails. But if it doesn't, if it passes, then we'll move to a different schedule. So we appreciate once again your time today, board members and staff members, for coming in and sharing your knowledge with us. At this time, I will entertain a motion to adjourn if we have nothing else to discuss.
Motion to adjourn.
Second.
All right. Once again, it's been moved and properly seconded. If there's no unreadiness, we are ready for the vote.
Chair McDougall,
Yes.
Vice Chair Dr. Ray,
Yes.
Dr. Rosemary E. Jackson, Dr. Jim Miller,
Yes.
Commissioner Alam, Dr. Glover, Dr. Orto,
Yes.
Mr. Gregorio,
Yes.
Mr. Josh Brown, Dr. LaRon Jackson.
Yes.
Thank you.
All right. Thank you again, everyone, for joining us today. We will see you all in